Hello everyone, and many thanks for the opportunity to present this paper. My name is Grainne McGettrick and I'm the Policy and Research Manager with Acquired Brain Injury Ireland, a national NGO providing specialist community neuro-rehabilitation services to people with a brain injury. In 2021, a paper entitled the 2019 Neuro-Rehabilitation Implementation Framework in Ireland, Challenges for Implementation and the Implications for People with Brain Injuries was published in an international journal, Health Policy. The publication of this paper represents a significant piece of collaborative work with a team of academics comprising policy analysts from Trinity College Dublin, Dr. Sarah Burke, Dr. Sarah Barry and Manjula Madhakandan, and Dr. Karen Foley and myself from Acquired Brain Injury Ireland. According to the World Health Organization, rehabilitation has been a low priority for many governments. Policymakers have had limited knowledge and understanding of rehabilitation. As a result, we have an underdeveloped, poorly coordinated set of services. There have been renewed calls from the World Health Organization for national governments to scale and deliver rehab services. In Ireland, there has been limited policy analysis or publications in relation to policy developments on neuro-rehab for people with brain injury. Therefore, this paper emerged as a result of a way to address the vacuum in the area. The aim of our paper was to describe and critique the challenges of implementing improved neuro-rehabilitation services in Ireland. While the focus of this paper is Ireland, literature shows that challenges relating to the implementing effective rehab services are universal. So I think what we have to say will resonate with many of you, regardless of the country you live in. The writing of this paper involved two major strands. The first strand included documentary and policy analysis. This involved the team analysing 9 key policy documents, some specific to neuro-rehabilitation policy and others from the broader Irish health policy arena. The time frame involved relates to policy documents from 2001 to 2019, an 18-year period. The second strand involved Acquired Brain Injury Ireland hosting a policy roundtable of stakeholders to enable frontline analysis of existing services, including identifying service gaps. The documentary and policy analysis was presented to a policy roundtable of experts in 2019. The engagement of this stakeholder group with the issues identified through the policy analysis reinforced the findings and legitimised them in the context of frontline and patient experience. Through this dialogue, the challenges to effective implementation of the neuro-rehabilitation policy were further defined. So what did our analysis say in relation to policy issues for people with acquired brain injury? Interestingly, the biggest challenge for people with ABI in terms of health services is that regardless of their income, their private health insurance or medical card status, the quantum of specialist rehab services are extremely difficult to access, and in many instances, they simply don't exist. In addition, policy progress has been extremely slow and key milestones for implementation have been continually missed. A good indicator of implementation intent is priority for a specific action and a clear budget allocation, yet there was no extra funding earmarked for neuro-rehabilitation services in the 2019 Health Service Plan. Such slow progress means significant gaps persist in neuro-rehabilitation services. Various policy documents noted that neuro-rehabilitation services are underdeveloped and where they exist have developed in an ad hoc manner. Specialist inpatient services are concentrated at national level, while services in the community are very fragmented and uncoordinated. There are references to long waiting lists, limited access to specialist rehab, and the dearth of community-based specialist rehab services, inappropriate use of nursing home and acute hospital beds due to the lack of rehab services in the community. The complete lack of data on the brain injury population has major implications for policy development, service planning and delivery. Various policy documents specify how the absence of epidemiological data on the brain injury population is a major challenge to the strategic, coherent and evidence-based planning for neuro-rehabilitation services. This in turn presents difficulties in terms of costing and financing services. Due to the lack of reliable information, it's not possible to map out the precise levels of services that should be provided to meet needs. Financing and the level of investment required for full delivery of the policy commitments is not quantified in any of the policy documents analysed. Some services are costed, but there is no attempt to provide an overall figure. Some of the policy documents reference the need for new and additional investment and note that requests for funding for specific projects have been sought from government. The lack of rehab services has a direct impact on the lives of people with brain injury and their families, amounting to lost potential. people with brain injury experience delays at every point of the pathway from hospital to home. In some instances, they do not have access to the necessary neurorehabilitation services due to the lack of availability, and access is often based on a geographic lottery. The lost potential has serious implications, not just for the individual with the brain injury, but for their families and for society. The paper concludes its analysis by presenting a series of recommendations for policymakers. Firstly, there is an urgent need to gather better data to inform policy and service development. Data is critical for policy development, service planning and advocacy as evidence for the making of the case for better use of existing resources and new investment. Secondly, we need to increase the visibility of people with brain injury in their roles as advocates and to increase political priority on neurorehabilitation to better meet the needs of people with brain injury and their families. Thirdly, the process of bringing about large-scale change in neurorehabilitation services provision requires a collective vision, the formation of alliances and leadership. Clinical leadership is necessary to create alliances and drive reform within the health services. The brain injury community needs to work collaboratively and collectively to ensure effective political engagement, as noted in the World Health Organization Rehab 2030, a call for action. Finally, influencing the wider health policy agenda, in particular delivering on the health service reform programme with its goals of universal access of timely, quality, integrated care pathways, is a critical element in shaping the future lives of people with brain injury. The evidence is clear that early access to specialist neurorehabilitation services enables people with brain injury to recover faster and better and achieve the best outcomes for them, their family and society at large. The paper concludes that if governments can overcome what is often short-term thinking and prioritise the implementation of neurorehabilitation services through a robust policy process, they can make a life-changing difference for people with brain injury and their families. And here is the link to the published paper and my email address if you wish to get in touch. Many thanks for listening.